everyone, welcome back to this channel. This is Joy Goloji, and today's video is going to be talking about how to prepare for a nursing job, how to prepare for the interview, what are the things you need to put in place when you're applying for a nursing job. So what are the things you need to put in place, the requirements? First, you need to make sure that you have your CV in place, and your CV is having your details, your basic details, demographic, like your name, your date of birth, your address, your phone number, email address. All right, those bits are at the top of it, and then you're putting in your places of work from the most recent, the places you've worked so far from the most recent, like I said. So if you're currently working, you put that as the first one, and put the address of the place of work, the name, the address, the years you've worked there. Or for instance, you started working there in 2022, you can put from 2022 to present. So 2022 to present, that's for the first part. And then underneath that, you can put the skills you currently have, you currently do in that place of work. So for instance, you are a registered nurse, you work in A&E, you admit patients, you discharge patients, you do observations and all those things. So put them as the duties and responsibilities in that place. So you do the same for the next one as well. So the place you've worked in the past, say before 2022, you've worked in another place, you put that there. So the so place, Zima Hospital, Keja, you put that there, put the years you've worked there, where the place is, and then put the duties and responsibilities you did there as well. So do so for all the places you've worked in. If it's only one, you can only put that one there. If it's two, put them there. Make sure you have them there, and also make sure you have references for the places you're mentioning. So for the Redeemer place, for the place you're currently working, for the other one, make sure you have references, because they are going to be needing them to ask them how you've been so far in those years, in that bracket, because they're not actually wanting to know if you actually work there, not just that, they just want to know that if you've been of good character within that period. Say for instance, you're working currently in one hospital and you've only started working here 2022, like I said, and it's 2024 now, so it's 2 years. And before that 2022, they don't know how you've been in terms of character, they don't know what you've been like, they don't know who you are, if you've stolen something before, if you've gone to rob a bank before. So they need someone to attest to the fact that you've been good, you've been of good character before that 2022. That's the essence they usually get referees from you. So if for instance you're not able to provide referee for all the places you've worked, you can also use a character reference. So most places allow you to use character reference. The character reference is just talking about your character for that period of time. They want to know how you've been like that period of time, someone to attest to the fact that you've been good, all right, for that period of time. You're putting in the places you've worked, you're also putting in your references at the end of the CV, and their name, their address, their phone number, email address. So you can put their name, phone number and email address only. You don't necessarily have to put their house address. So those are the basic things that really need to be on your CV. And then I forgot to mention at the beginning, after your name and your address, your mail address, your phone number, just put a short thing, a short box talking about what you do, the skills you're good at, your interpersonal skills and all those things, like as a short box to describe you from head to toe in short sentence. So you can say I'm good at communication, make it a sentence, not just one line. So you can browse online as well. You can browse Google to find out CV format you can use. There are a lot of CV formats on Google. You can go there and choose the format you want to use and follow through with that. So make sure you have your CV in place. Make sure you have your cover letter. So this cover letter is just one you're using to apply for that to that particular hospital. Say for instance you're applying to Elizabeth Hospital, you're applying to London Hospital. Cover letter is the one you actually say, just like a short letter. If you don't know what cover letter is, you can go on Google as well to find out more about that. So make sure you have that in place. Make sure you have your license, your certificates in place, license from nursing body, nursing and midwifery council body, your certificates. I think those are the two things they always ask from you. If you're applying for a job in the UK, they might ask for other things like your IELTS, your CBT and all the rest. But if it's within your country, they don't really need that. And when you have all of those requirements, I'm not going to talk about how to prepare for your interview. So most of the basic questions they ask in interviews, I have a video about this, how to prepare for interviews. I'll attach it to the description of this video so you can go in to watch that, so that we don't necessarily have to repeat things again. But know the basic questions, because one of the very common questions they ask is tell me about yourself. All right, so telling me about yourself, they are expecting you to tell them what they're expecting you to tell them what is in your CV, but not necessarily everything. So they're asking you to tell them who you are, your name, where you've worked so far, from the most recent place to the least recent. They're asking you to tell them about your duties and responsibilities in those places, generally your duties and responsibilities as a registered nurse. They're expecting you to tell them your interpersonal skills. Are you good in communication? Are you good in slapping people? Are you good in all those things that you have to do that are outside of the nursing field? Those are your interpersonal skills. Are you good in keeping up to time and things like that? And then they're asking you for your dreams and your aspirations, what you hope to achieve in the future, what you hope to gain from this job, the certificates and qualifications you hope to achieve in future, and all those things, your dreams and aspirations. So your name, your current place of work, your current duties and responsibilities, the field you're working in, the area of specialty you're working, your interpersonal skills, your dreams and future goals or qualifications, and all the rest. So that's just like a summary of what they're expecting you to tell them, where you've worked from beginning to the end. So currently I'm working in so this and this is what I do there. Before I used to work in so and so hospital. These are what I used to. It's not just one line thing. Just tell them like a story, like a story form about what and what's your area of specialty in that particular place you work in or you've worked in the past. I don't know if you're understanding me. You can let me know in the comment section if you're not. And like I said, prepare for your interview, and I have the link to the video in the description. And so you're telling them about this, making sure you have all of this in place. And when you're presenting yourself for an interview, you want to be smart. You want to present yourself in the smartest way possible, confident. Don't look down on yourself. Because you're a professional, right? You're a professional, you should know what you're doing. You don't want to look down on yourself before someone else does. So present yourself as smart, confident. You go there prepared. Don't go there half prepared. Preparation is already taking half of the task away, all right? You have to go there prepared. Go there knowing what you want to say. Go there knowing who you are before someone asks about who you are. And at the end of the day, when you're successful, they are going to ask you for your documents. They are going to ask you to present your certificate, your CV, your license, and any other thing they might want to need from you. If it's UK, it's more. They're asking you for IELTS results, your CBT, your transcripts, all those kind of things. They are asking you more. But if it's in your country, your current country, they might not need to ask for all those details. So that's just how to prepare for a nursing job. You can drop any question at all in the comment section. I'll be more than happy to respond. Thank you so much for watching. Don't forget to subscribe to this channel. See you next time. Bye bye.